Hey y'all, welcome back to my channel. So today I'm going to be doing a postpartum video for you, talking about everything that people don't talk about. When I went into labor, I heard all about pregnancy, all about labor, but I didn't know anything about what to expect afterwards. And I feel like you need to be prepared. So if you are expecting and you're getting ready to deliver, then I really suggest you watch this. First of all, disclaimer, I'm going to be getting into a lot of stuff that is not the most pleasant thing to hear, but just remember it is all 100% worth it in the end because you get your very own adorable little cutie and it's so worth it. There's gonna be a lot of pain, there's gonna be a lot of tears, but I promise you, you'll be happy in the end. She's been a little fidgety, so I do have to hold her through this video, so if she gets a little fidgety, please excuse that and try to pay attention to what I'm saying because she is pretty distracting. I mean, look at her, she's so cute. First things first, this is mostly for vaginal delivery. At least the beginning part that I'm going to be talking about is for vaginal delivery. If you have a C-section, then skip to the part where I talk about breastfeeding if you are planning to breastfeed. So once you get out of the delivery room, if you had an epidural, you're gonna probably be really itchy afterwards. I was like scratching my legs so hard. When I looked down, my legs were like so red from scratching and I didn't even know because I can't feel anything down there and I was scratching so hard. So just be careful of that. I didn't take anything for it. When you do get to your recovery room, they're gonna offer you like a Motrin. And if you're in a lot of pain, feel free to take it. I only took one Motrin the whole time. I definitely was in pain, but it was tolerable, and it wasn't like the worst thing in the world. I really don't like taking medication no matter what it is, even if it's Motrin, so I didn't, but if you need it, by all means, definitely go ahead and do it. First of all, they're gonna have you wearing these granny panty old things, and you're gonna be wearing them for a while, so I definitely recommend asking to bring home bags of them, and they'll give it to you, which is great because when you get home, you don't wanna wear your tight underwear because the next thing you're gonna have in there are these huge pads. They're literally like diapers, like they're really big pads, and you're gonna need it because you are bleeding a lot, unfortunately. I did bleed a lot, and it sucked. I bled for like 3 weeks straight and it was really annoying, but we all get through it. We all have to go through it, and yeah, so I definitely wore these like all the time, and the great thing about having extra is that you can just wear them, throw them away, wear them, throw them away. I mean, you don't want to like keep these afterwards. They're pretty ugly. I was walking around my house and like these huge pads and like this, and I'm sure my husband thought I was just so beautiful. All right, so I just went and put her down for a little nap so I can talk a little bit easier. Now I have my hands free, so that's nice. Okay, little tip, as soon as you have a baby, forget about being able to do pretty much anything with your hands because you're gonna always be holding them. It's amazing, but keep that in mind. So try to get all your work done before you go into labor. So anyways, you have these undies, and then you have the pads, and you do have contractions during that time. So that's something that I didn't realize about labor. I thought, you know, I have contractions when I go into labor. Obviously, I knew that. Everyone talks about that, but no one told me that those contractions still can continue afterwards, especially if you're breastfeeding. During breastfeeding, a lot of times you're going to feel that feeling of a contraction happening. And what that is, it's your uterus actually contracting and getting back to becoming smaller again, which you want to get your tummy back, but it's not very pleasant. It's not fun. I hated the feeling so much. I mean, who wouldn't? But something to keep in mind if you're having that pain, it's probably the contraction, so don't get scared. I was a little nervous at first, but that's most likely what it is. So anyways, after you are wearing the pads, you're wearing these gorgeous underwear, say you have to pee, what happens? Having to pee is like the worst thing in the world when you're going through this. It hurts so badly. It's the fact that it's like acidic, I guess, touching the open wound hurts so much. So in the hospital, they give you this squirt bottle so that when you're peeing, you can actually squirt warm water, and it's supposed to be helpful. It is helpful some, but if your pee still touches the wound, it still hurts. So I actually got this. So this is called a Frida Baby, and this can actually go and squirt and make sure that you're really cleaning the area well. So it really can kind of get up in there a little bit easier than just like squirting. I definitely do recommend this. I was really stupid and didn't know how to use it for some of the first few days. I was like trying to like aim it and it kept moving. So make sure you pull it out and then squirt. But yeah, so use this. So the first thing you do is you're gonna pee and then you're gonna squirt yourself. And then to wipe, you don't wanna wipe with toilet paper because I guess it can kind of get stuck, like if there's any scabbing or if there's like stitches there, like you don't wanna use that. So in the hospital, they're gonna give you these. They're kind of like gauze but softer, I guess is how I'd explain it. Definitely try to get as many of them as you can to like bring home so that you don't run out, because it's a lot easier to wipe with these and it just like doesn't hurt as bad. So then you use this, and then the next thing they're gonna do to give you is these, if you're lucky. I mean, my hospital did give me a lot, which is nice. It's pre-moistened witch hazel pads, and these actually feel really good on. So when you're, after you wipe, you want something like cool down there because it burns and hurts. So this is really nice. Definitely, like I said before, try to bring more home with you so you don't run out and you don't have to be like stingy with it. But then I would like wipe, I would just like kind of pat a little bit. The hospital also will give you Dermoplast. It's like a spray and it helps with anti-pain and just like helps with the pain. It's anti-itch. I didn't really have any itch, but it did help with pain relief. So then you can use this. And what I got is actually this. It's called the Mother Love Sitz Bath Spray. And I know this sounds like so much. It is a lot, but all of these things really do help with the comfort and care that you're gonna need down there. So this is a Mother Love Sitz Bath Spray. And I really like it. It's like an herbal remedy and it's just soothing and feels good. So I do recommend this. You can just kind of spray a little bit down there, and it's just kind of a cooling effect. It is really nice. So then I would recommend just spray a little there. I think I hear the baby, so I might have to pause in just a second. Oh my goodness, it's like up, down, up, down. You'll understand soon. So then once you finally do that, you can pull up your pants and get on with your day. I remember when I had to pee, it would be like so traumatic. I'd be like, oh, I just don't want to pee, I don't want to pee. And then finally I'd go into the bathroom and then I'd pee, and it would be like 15 minutes later when I could finally leave the bathroom because of all these things that you gotta do. So there's definitely a lot that goes into caring for yourself. Oh, and I almost forgot a couple more things down there. First of all, ice packs are your best friend. Try to get as many of them to go home with you because I only brought home like 4 and I wish I had more. So in the hospital, they'll give you, it looks like a pad, but actually you can crack it and it's ice, and you can put it down there and it just feels so good to like just like sit on something cool because you're just like in pain. So I highly recommend like getting as many of them as you can and like bringing them home. The other thing that you're gonna wanna do when you go home is take a sitz bath. This is just like one of those basins you can get in the hospital. You bring it home, you fill it with hot water, you put some Epsom salt in there, and then you kind of like just like sit on it. And it's gonna clean you out. And you wanna try to do it 3 times a day if you can, if possible. Sometimes days get by and it doesn't allow for it. But if possible, it will help with your healing process. It will help to clean you down there. So I definitely do recommend like bringing this home, doing this 3 times a day. It will help, it is worth it. Also, in the shower, you gotta get one of those shower handles. Those showers that have like a shower handle. I bought one from Amazon just to switch out. I switched out my whole shower thing, and like now I have one of those just like portable ones that you can like spray up there. I'll link the one that I use down below because I absolutely love it. It's like so soft on, it feels like so good. So I'll take it and I'll like clean down there, and it just like feels really good. I shower every day and it's just like, it's my favorite thing to do during the day because I just feel so much cleaner and better. And yes, highly recommend buying one of those like portable shower handles, I think they're called. Yeah, all right, so I think that's it for like the down there talk. Just make sure you take care of yourself. I know it's painful, we all go through it. Some are gonna be worse than others, some are gonna be better than others, but you're gonna get through it and you're gonna have your little one and it's all gonna be worth it. So I believe in you, you got this. All right, so the next thing is when your stomach is contracting, starting to get smaller, when you feel those contractions happening. After delivery, I thought, I was under the impression like, oh, I'm going to have the baby and my stomach's going to be gone like the next day. Doesn't work like that, unfortunately. I kept thinking, honestly, I'd be back to normal totally within 2 weeks. It didn't happen that way for me. I got better, I definitely got better every day. It was an improvement, but I'm 5 weeks and I'm still not back to normal. Some of my jeans fit me, some of them don't. It's like sad, I'm like, is this gonna ever fit again? But it will, it just takes time. I actually got one of these. This is like a waist trainer. I don't know if you can really tell, but just kind of sucks you in and kind of like holds all of that in. I used it for like a couple days. I would use it, and after I used it, I definitely did see a difference. Like after I would take it off, my husband would always say, oh wow, like you look really, like you look like you're losing the belly weight or whatever. And like I would look better. It definitely did help, but I hated wearing it, so uncomfortable, because like you're constantly sitting because you're breastfeeding, and like it's just very constricting, so I didn't love wearing it. But if you're looking to like get this belly weight off faster, then I do recommend it. It does help, it does work. The next thing that nobody talks about, at least no one talked about it to me, I had no idea. First of all, everybody talks about stretch marks, right? Everyone says during pregnancy, lather up with oils, use lots of oil. But nobody told me that you're supposed to use lots of oil after you deliver for your boobs. Like, I did not know that that was a thing. I used it all through my pregnancy, and luckily I have no stretch marks, which is amazing, on my stomach. I thought I was gonna have stretch marks so much on my stomach, and I had none. I constantly was lathering up, I was doing great. But then I gave birth, and I'm like, great, I don't need to do this shit anymore, excuse my language. But then what happens is all of a sudden your milk starts to come in, and my milk was starting to come in, and then one night, overnight, my milk just like came in, and my boobs literally grew like 3 times the size. Like, all of my friends that have seen me, that like knew me before and see me now, were like, Cher, your boobs are huge. Like, and my husband is like, Cher, it looks like you had implants. Like, they literally got so big, like overnight. I didn't know you're supposed to use oil, you're supposed to be lathering up when you're producing that milk. So please, like, learn, if you learn anything from this video, learn that it's not like your oils and your stretch mark cream does not just happen during pregnancy. It happens, you need to continue doing it afterwards. Don't make the mistake that I did. Right now I've been using a lot of like coconut oil, and this is just what you can get like at Trader Joe's or, you know, over the counter anywhere. It's just organic, unrefined virgin coconut oil, and I just lather it on. The reason I like this is because it's safe for the baby as well, because she's gonna be around the nipples. I wanted something that, you know, if she's gonna be putting her face all in there, I don't want anything that's like unhealthy for her, so I'll put this on the boob. And it's actually safe to put on your nipple as well. If your nipples are hurting or your nipples are cracked, this is actually a great thing to use on your nipple. And the lactation consultant that I had met with told me the reason it is so good because like the baby will actually like it and feel like it's just a little bit sweeter, the nipple. So it can only help you, it can't hurt you. So I definitely recommend getting some coconut oil or any kind of stretch mark cream that you want, and lather it up like non-stop as soon as that baby is born, or beforehand too if you want. Now the next thing that happens, breastfeeding. I always knew about breastfeeding, but I had no idea how badly that it could hurt. For me, and I'm sorry, I'm not trying to scare you away, I am breastfeeding now, everything's good now, so there's a light at the end of the tunnel. But when I first started breastfeeding, it hurt so badly. Like my nipples, oh my god, I feel like honestly my nipples are starting to hurt just like thinking about back then. My nipples were getting cracked. They were, first of all, my nipples were so cracked. It was so painful. Every time she would like suck, I would have to like hold my breath and be like, okay, I'm doing this for her, I'm doing this for her, I'm doing this for her. But it hurt so bad for me. Not everybody's like that. Some people doesn't hurt them at all and they're like great, but for me it hurt for some reason so much. So I was buying like every kind of nipple cream that I can find to try to help it. So this is the one I used the most, which was lanolin. I think I'm saying it right, I don't know if I'm even saying it right, lanolin cream. And it's for soothes and protects our nipples. I use this, as you can tell, like all up. I did really like it. It is gooey, but I did feel like it helped a lot. Something I was recommended to me is the Earth Mama organic nipple butter. I did like this, but it's like one of these and you have to like scoop it out and put it on. This was pretty good too. They're both good to help, but honestly it just takes time and your baby getting used to your nipple and you getting used to the feeling of your baby biting down and making sure she gets that good suck. So I use these two. I also would use someone sent me, it's called Dr. Lip. It's original, so it says it's called Dr. Lip Original Nipple Balm. Oh yeah, Dr. Lip Original Nipple Balm for dry skin, luscious lips, and glossy bits. So it's for your nipples, but you can also use it on your lips as well. And it actually is very smooth and soothing. So this is another one that you can definitely try. Also, if you don't want to go buying all these things, totally understandable, just get the coconut oil, put it on your nipple, put it on your boob. It'll help with stretch marks, it'll help with cracked nipples. but I promise you it definitely does get better. Some people last longer than others. For me, my nipples were hurting, I think it was like 3 good weeks for it to really, till it stopped hurting really badly. But now I can just like put her on my boob and she's good to go. So it does get better. You just have to like bite down and know it's gonna get better, it's gonna get better. I promise you it does. As for like weight loss and things like that, it's gonna come off over time. You're not supposed to work out for the first 6 weeks until your follow-up appointment. I have my follow-up appointment next week, so I'm really excited for that. But you know, it does go down automatically. And when you're breastfeeding, you do have to have 500 extra calories a day. I didn't know that either. I thought I was gonna be working out right away and eating well, but you can't. You have to eat a lot. You gotta eat 500 more calories. You gotta be drinking a lot of water because you get super dehydrated all the time. So something I didn't realize is that afterwards, I didn't realize how much I'd have to hold her. I love holding her, but I didn't know that how much I would have to hold her in order to make her come. So I like didn't prepare any foods or anything, being more prepared than I was. So when I got home, I didn't have any food really prepared. I'd have to like order in, but it's hard. You have to be eating all the time. You're hungry all the time and you don't have time to go making things. Just pulling things out of the refrigerator is sometimes hard. So what I did was buy frozen meals. I bought Vistro. It's like a vegan frozen meals, and I had meals for 2 weeks. So when my husband would go to work, I'd be able to have lunch, or when you come home we can have dinner, and I didn't have to worry about it because you have enough stress going on with the baby. You want to be able to hold the baby. You don't have to think about, oh, how am I going to soothe her so I can quickly make food so I can, like, you don't want to think about that. So just like either buy frozen meals or pre-make food, however you want to do it, but you don't want to have to think about having that. You don't want that stress of having to like cook when you have a newborn. Also, grocery delivery apps are like your new best friend. That's how I've been getting my groceries. Once the baby is born, until they have their 2-month appointment, you're really not supposed to take them out to any crowded places. And the reason is you don't want them to get sick. If they have 100.4 fever or above, they have to have a spinal tap, which is really scary, and you don't want to put them in any danger at all. So we've literally been staying home for like 2 months, or going to the park, we go for walks. That's her talking. I'm gonna go take her for 1 second. I'm gonna bring her back here. Okay, so I changed her diaper and I had to take off my necklace because she tends to pull it, just like she's pulling my hair. Anyways, so make sure that you have some sort of thing planned for your food. And remember, Amazon is like your best friend. Get Amazon Prime if you don't already have it, because you can order things so easily, because you can't really take them out before they're 2 months like you can, but you're risking it. I'm just like hanging out with her at home, enjoying our mother-daughter bonding time. And when I do go out, like say I want to go out to dinner, like I'll sit outside away from other people, just because you can never be too cautious, especially when they're so young and fragile. I mean, we just cooked them for 9 months in our bellies, and so I can't like let anything bad happen to them. We're their protector, so you have to remember that. Just get ready to get kind of stir crazy, but also try to just enjoy it, because this is such special time with your child that you'll never get back again. I also wanted to say something that I forgot to say before with regards to pooping. I didn't say. She reminded me when she just went to the bathroom that afterwards it might be hard for you to poop. Like, it's hard to push. You just pushed so hard that I don't know why, but I had trouble pushing after that. So if you need, you can always take like a Colace or a stool softener to help. Don't feel like you can't. That's always an option. That's something that a lot of people do experience afterwards, so just be aware of that. Make sure that you are having bowel movements, and if you're not, then definitely, you know, speak to your doctor about that. Okay. And finally, you know, enjoy this time. Really enjoy it with your family. Make sure you take time for you and your partner to be together with your child. I know a lot of people are going to be wanting to come over and see the baby and enjoy that too. Accept all the help you can, especially if you're by yourself or you're a single mom, or your partner is going to work. Like, definitely. I should go to the bathroom. Definitely accept all the help, but when there is time for you and your partner and your child, so make sure to enjoy that, because it's that special bonding time with your family. Like, you have a family now, like a little family. Like, really try to enjoy it. But anyways, I hope you enjoyed this video. I'm sorry about all the squirming and all the stopping, but that's what life is now like, and you're gonna have that soon too. So best of luck to you. If you like this video, then please give it a thumbs up, and don't forget to subscribe. If you have any questions about postpartum, then please leave it in the comments down below, and I will definitely try my best to get back to you. All right, best of luck, and we will see you next time.